If you find that your baby is suffering from a burn or scald, it is important that you know what to do so that they will have the best chance of survival. In order to make the right decisions, you must know how to check for burns and how to treat them. There are a number of common causes of burns and scalds within the home. Dry heat burns, such as flames, fires, hot irons and cooker hobs. Wet heat burns caused by liquids such as tea, coffee, kettles and other cooking pots. Electrical burns and chemical burns. Burns and scalds can cause permanent, life-changing injuries, disfiguration and even death. Likely signs of burns that you will see on your child will be crying or pain, swollen and red skin, blisters or peeling skin, burnt and blackened skin, loss of tissue, and finally unconsciousness. For the treatment of any burn, first remove your baby from the source of the heat. Then begin to cool the burned area for a minimum of 20 minutes. So we have our burn here, and we're going to apply the water, fresh running water, but we're going to apply it above the burn so that it doesn't go directly onto the burn and cause further pain. Continue to cool for a minimum of 20 minutes or until the burn is cold. Do not use ice, lotions, creams or gels on the burn as they can damage the skin and lead to infection. If clothing is stuck around the burned skin, do not force it off. Cut around the clothing and remove. To cover the burn, use cling film, stretch wrap or a clean plastic bag, and do not apply pressure directly onto the burn. Take a long roll of cling film and apply over the top of the burn, gently. This is to keep any bacteria out of the burn. If cling film is not available, place the burned area inside a clean plastic bag. Do not use any plastic coverings if it is a chemical burn, as the plastic can melt onto the skin and cause more damage. In all but most minor cases of burns, seek medical advice. If a baby or child gets burns on their face, hands, feet, airway, genitals, the burn is larger than their hand, or there is tissue loss, these are classified as serious burns and are life-threatening and require fast first aid treatment and immediate ambulance assistance. Call 999 asking for the ambulance service, explain the nature of the burn and stay on the phone. Treat the burn in the prescribed manner and continue to monitor their levels of response and breathing. Once the child is stabilised, check them for other injuries, treat them for shock, and avoid the baby or child from becoming hypothermic from the cold. So in summary, the treatment for burns: make safe by removing them from the source of the burn, cool the burn, cover the burn, call 999 as soon as possible, continue to monitor their response and breathing, treat for shock, and avoid hypothermia.